Hi, friends. It's Dr. Mary Gardner with Lap of Love Veterinary Hospice. And today's Facebook Live, we're going to be talking about Churu, a cat puree. And so today, I've got our special guest and my friend, Becky, from one of the distributors of Churro. Hi, Becky.
Hey, Mary. Hey, my name is spelled wrong on that, just FYI. It's totally fine.
I think we're forgetting to listen. Blomenkamp is just as fun.
It's true. They can call me Becky. It's okay. But yes.
Right. Listen, I'm Mary, so that's okay too. All right. So we are talking about this product called Churu.
You've got yours?
I've got mine. I've got a whole bucket full of this, and I know there's a few of our friends at Lap of Love that love this stuff. Can you explain what the heck it is?
I can, yeah. So this product is called Churu. It is a all-natural appetite motivator for cats. So I believe the product's been out for about 2 years, and that's when Clipper launched it. And since then, it's really taken off. So it's unlike anything else that's out there in the veterinary space. So I know you've got your little sample here, but I'm trying to think of a good word to compare it to. So you can see it's probably about 6 inches long. It's a little stick, and it's got a nice little flavored puree in it that we give our kitty cats.
I'm going to open mine live on camera. Shall I do that?
Yeah.
Okay.
I have dogs, so I feel like if I open mine, they're going to run up next to me. And they're going to want a little bit. It's fine.
On here. So this is for everybody to see. But it's really like thin.
It does not look appetizing at all, but cats really dig it. So.
Actually, I just got a good whiff of it just now.
It doesn't smell good, but as a veterinarian, when you're trying to get a cat to eat, right, this smells better, right? Like, what are the old tricks of the trades that people have put in front of cats for all these years? Like tuna.
Correct. This actually does smell like tuna. Okay, this is the chicken recipe, right? Whatever smells bad, usually cats are after. Whatever just is bad, that's what dogs go after, like cat poop. So right. You can just squeeze it out. It's almost like the toothpaste you get at like the travel section. Look at.
It is kind of like that. That's true. I like that you let people see that though, because it does have. You call it a puree, but it's not necessarily very liquidy, right? It has a little bit density to it, which makes it kind of nice and thick for when you're using it for your cat. So, this product came out about 2 years ago. It's meant for, I say everything under the sun. So, it's an appetite motivator. It's used for hydration. It's used for exam distraction. It's used to weigh kitty cats in your hospital. It's used to help pets recover post-op. If you're sending cats home and they're needing a medication to be delivered, it's great for that. So as you can see, that little thick.
Yes.
Yeah.
That little I think is great for is hiding medications.
Yeah. So VMX, I'll talk about this, was one of the first shows that we've worked, since the last, year and a half or whatever. And we had a lot of great feedback from veterinarians on how they were using Churu. And we had so many tell us so many great reasons on why they were sending it home for their kitty cats, right? So we've got friends, we both know Caitlin. I'm sure she's probably watching this, but she had a really bad cat that an older cat who's now since passed away, but she could not get his pills down him, right? So he was a biter, he's a scratcher. And until she tried Churu, of course, I dropped a can of stuff at her house, he couldn't get the pills in him. So what she would do is tear open the top. I forget what it was, which one she was giving him, but she would put the pill in here and then she would just go like this as like a stick and he would lick it, or she would put it down there. I know. So to get cats to take pills, right, is always a challenge. Nobody likes to pill a cat. That's not something that usually works out, but medication delivery is something that, a lot of clinics don't think about after they send the cat home with the owner and it may be ill and they need a way to get those medications down those cats.
Totally. I never thought of that. You know what I know some of our clients have done is put this in the freezer. So it's like a little Churu pop.
Churu pop. So either as a stick, and I've heard that for dogs too, which is interesting, like a popsicle or whatever you want to call it too, also for exam distraction. And I know you and I haven't talked about this, but at VMX too, we had so many vets telling us that they buy, so you've got the big lick pad, right? And that's probably for like dogs. No, not the Churu, the lick pad, Mary.
Oh, the licky pad. Yes. Sorry.
The lick pad, yeah. Simple lick pad. So you have a big one, probably meant for dogs. Well, they make smaller ones. I gotta find that company too. And they make for kitty cats, right? So they're circular or even square. So a lot of practices are putting the chewer, right? They're squirting it on their little lick pad. say 10 of them, and they're sticking them in their freezer every night. And then throughout the day, as they're seeing their feline patients, whether it's for, a well visit, a sick visit, if it's exam distraction, they've now got these little lick pad with Churu on them while they're doing their exams or whatever else they're performing. I thought that was a brilliant idea.
Listen, for people who don't know what the licky pads are, the lick pads, it's got these little nubs. It's almost like a giant cat tongue. And, it's all a little spring. And I will put, applesauce or baby food or whatever in here, but you put the Churu in here. And I love that idea for families that have difficult cats or just want to give them a yummy treat. Okay. It's not just sassy ones. Why can't the good ones get some good treats too, right?
No, totally. Well, and that's what's interesting. And I know I'm going to probably ask you that too, but we talk about a lot how Churu is used in general practice, right? It's used for your healthy pet. People put a little squirt of Churu on the scale while they're weighing their cats, right? So they can get an accurate weight, which I think is brilliant. But it's interesting to talk about how this is used for not well cats, right? And so I know you are all things the gray muzzle dogs, right? But I forget what your term is that you call the kitty cat. What do you call your old kitty cats?
Crunchy cats,
they're all kitty cats.
And I love me some old kitty cats. And I know there are families, people watching that have them. So what I usually do for my hospice patients is a few things. One is absolutely the medication hiding aspect of it is to get it in there. But two, a lot of these old kitty cats, especially ones with kidney failure, need to get fluids, subcutaneous fluids. And there are some wonderful families that are comfortable giving that. But I will say, put a little Churu on, a little mat. It doesn't have to be a licky mat either. It could be a little saucer or whatever. And so that way, while you're doing the fluids, they're totally distracted and they won't feel anything. So those are some ways. Also, a lot of our cats are in hospice are not eating well at all. And at this point, we just want anything down them. And this is, a really good option. And sometimes, like you said, it could help stimulate their appetite to then want to, eat more. So it's not, like a medicine, like an appetite stimulant, but it kind of gets the gut going and it's something for them.
Well, and if you want to add some numbers to that too. So I don't know if people know, but we do have 2 different formula versions. And so I think you have the Nourish. I have the Nourish sitting next to me.
Yeah. What are the differences?
There we go. I'll tell you there. So there's the Diet and there's the Nourish, right? So one's blue and one's green. So the Diet, and I know that's kind of a general term, but it doesn't mean, it's for weight loss cats, right? It's just the diet version. It has 4 kcals in it, but it has about 93% moisture content in it, right? So when you're looking for those hospice kitty cats, when you're looking for those end-of-life cats, your crusty old kitty cats that we know aren't drinking water out of their water bowl anymore, or, they're having a difficult time just keeping hydrated, something that you can give them, just even a stick of this that has 93% moisture content in it is huge. The difference between the Nourish is that it has 12 kcal, but still really high on the moisture content at about 88% on the Nourish.
How many calories are in the Diet?
The Diet is 4 kcals and the Nourish is 12 kcals.
Okay, good. Okay.
And when you're looking at Diet has about 93% moisture, Nourish has about 88% moisture.
That's so cool.
Super high on both of those too, right? So what else can you give your cat, other than IV fluids or relying on them to drink water out of their water bowl that has such a high water content in it too, right?
Right. No, that's excellent. So Dr. Sheila Robertson, who's watching, she says that Churu is like crack for cats.
She's good. Yeah.
Somebody else said it. I didn't, but I do agree. It is a little bit like kitty crack. Now, can you tell me the difference? Well, tell everybody, because I know the difference. What is the difference between the veterinary formula and because this can be found on Amazon, but it's not the veterinary formula. So tell us the difference.
Right. So if you can find Churu, you could Google Churu, right, and find it online somewhere. It will not say veterinarian formula. Okay. The veterinarian formula is only purchased from your veterinary distributor. Okay. It's offered through all distribution. So anywhere your practice buys any of their goods from, you can find Churu, right? And you're going to find the veterinarian formula. So the differences is the veterinarian formula, 1, exclusively from a veterinary distributor. 2, it contains taurine. The OTC versions do not. Okay.
That's important, guys, the taurine.
That is important. Important amino acid there for kitty cats. I know this is always probably the most important one. We heard a lot about this at UMX in June. is that if you are buying the OTC version, meaning not the veterinarian formula, you're paying about twice the cost. Okay. So this is sold in a canister of 50. You guys can kind of see that. I've got to go the opposite.
There we go. Wait,
Wow.
there you go.
It's like opposite.
People don't understand how hard it is to be a video queen.
It really is.
It's like, what? So I'm doing it wrong again.
So 50 sticks. So there's 50 sticks in there. When you're buying it from a veterinary distributor, again, the cost is going to be about half for that container as you would find on OTC. You'll see some different versions on the OTC versions, different flavors that Inaba, the makers of Churu, make. When you are buying it from your veterinary distributor, you're going to find it in the tuna and the chicken.
I have tuna and chicken. That's what I have. So those are my versions for this, right?
Tuna and chicken, yeah. And I mean, kitties love it. They love both the stinky versions, as you can tell, and you'll find those both the diet and the nourish too. But yeah, it's important to know. We had a lot of folks, of course, with this last year purchasing this OTC and then realizing that they could get it from their veterinary distributor. So I know you want to talk a little bit about that and make sure they could find it from there.
Yeah, no, that's a good idea. Look, we got people there's Rick from Portland, Texas, and Bonnie from Pennsylvania. I love it. Also what I'll use this for, Becky, and it is during the time we say goodbye. So when we're euthanizing a kitty cat, I will sometimes give them a little bit of this to distract them because we have to give them a little medication under their skin. And if they're painful and they're already not feeling good, so I'd rather give them a little something yummy, to kind of distract them, and that's really helpful for that. I know it's a little bit on the side we don't want to talk about, but it
is interesting. Again, I know we talk more on the side of general practice, and especially when we're chatting with customers and clinics, that we're talking a lot about the daily use, right? How you're using it in hospital, how you're using it post-op, exam distraction. A lot of this, helping follow the fear-free approach with your kitty cats, especially for the exam distraction and things like that. But because of Lap of Love, because of what you do with end-of-life euthanasia, in these senior cats, it does bring a different use or perspective on how it fits for Lap of Love and how it fits for you all, which I think is interesting. And especially because you talk about those senior kitty cats a lot.
I do love them so much. And we at Lap of Love, if we do have a pet under hospice care, we can actually have a client get the veterinary formula through our online pharmacy. So they could do that too through us. So just so you know, or they can ask their veterinarian for it. But it is so yummy and totally safe for dogs. But we really want to focus on the cats because my dog is like this too.
We did a lot of that. We had just as much dog conversation at VMX this June, I think, as we did cats. And again, a stick of this is not going to last as long as it's on a 70-pound Labrador as it is on a 10-pound cat. But I mean, that's my joy is listening to people how they're using tips and tricks in the hospitals. And so we did create a private Facebook page that's for Churu vet professionals. And people share all sorts of stuff in there too on how they're using it in their practices and it's stuff like that I never would have thought of until we're talking to people and kind of sharing that feedback back and forth. But that was really, brilliant about the cat lick pads in the freezer. I never would have thought about something like that, until you have people telling you about that or giving it to the dogs as they're distracting them. Or we had a great veterinarian. I think she was from Mississippi. Oh, she was so hyper. She was so cute. She was so fun because she loves Churu. And she has, I think, 7 or 8 exam rooms in her hospital. And she has a canister in Churu in every exam room. And then as they walk in, if something's a cat exam, they're out there kind of on the table and they're ready to go. They know that they can use them. It's letting the customers and the clients be comfortable with what this is, how to use it, and then offering it to go home. And I think that's really bright, right? Because you walk into an exam room all the time and you see dog treats, you see dog bones, you see...
You're right. You never see cat stuff.
Never see cat stuff. And if you do see a cat treat, again, how likely are they to eat that cat treat in an exam setting?
This is why cats don't go to clinics. We don't, cater to them. And I think we should. This is a great idea. Now, Nancy says, hi from Pennsylvania, love Churu, helped me get the meds into the kitty before she passed a few weeks ago. See, that's so helpful. And if we can get them taking a few of their medications to feel, a little less painful or less anxious or maybe less nauseous or something like that, that's so helpful. It's amazing and stress-free. Thank you, Steve. That was a good one. I love it.
When you talk to your owners, Mary, about the Churu, do they ever ask the question like, how much is too much? We get that question. Okay.
Yeah. So what now? Most of our little kitty cats that we help are under 10 pounds. They literally are little 6 or 7 pound small guys, just muscle wasting, very dehydrated. So what is appropriate?
Are you asking me? Or are you telling me?
I'm asking you.
Oh, you're the doctor.
I want to make sure what I say is correct. Listen, half of these guys, I'm just happy that they're eating anything, right?
And that's really what I was just looking for, right? I mean, you're talking about something it doesn't have to be a dietary replacement, right? But if you're giving these to 6 cats, this is specific to Lap of Love. This is specific to what you're doing. I'm pretty sure you can't overdose on Churu with these cats, right?
No, the amount of kilocalories in here. No, I just want to get them eating. I want to get their meds in because a lot of these kitty cats we see also have nausea or, and they're not, and they're sick. And so I want to get the anti-nausea medication in them. How are you going to get that if you're trying to stick it in a regular cat food bowl, right? So this is super helpful for our hospice guys and our really sick kitties. So 12. Oh, it says on the thing 12 kilocalories.
It does. They do a really good marketing job with this. Yeah, everything you need to know. You've got all of your ingredient information on the back. Again, all natural. You've got all of your minerals in there, your calorie content, your feeding instructions. Your caution
instructions is what you're saying, Becky. Like
instructions,
like when I go to furniture, I put it together. I can't. Okay, so I've got one comment from Caitlin, and actually this is spurring something I should say. She used about a third of the tube on the cat's regular food and got him to eat his whole meal. And that's another thing I wanted to say is a lot of times if kitty cats are on a special diet, let's say kidney failure diet, and they're just not eating it anymore, I would say put a little bit of this, like a little gravy on top, and that might get them going.
That's good. See, this is the thing when I start talking about Churu, it's one of those things that does so many things that I usually forget to talk about one or two of them. And thank goodness you got Caitlin on here.
That's why there's 2 of us plus Caitlin watching. And then Nancy says, how can I find a vet distributor for vet Churu? So that, Nancy, would be asking your veterinarian to supply you with it. So a veterinarian has a supply company, right? So we all buy our supplies from a distributor or supply company, and then we can get it. So that's how you need to ask. So just ask your regular veterinarian, and they can order. As Becky said, like all the major distributors, because there's, let's say, a dozen distributors of our supplies, they will all mostly carry it. And then Claudia asks, are these available at local pet stores?
That I don't know. I know you can find it again, like we talked about before. You can find this online. Again, to stress, it is not the veterinarian formula.
Right.
And what is preferred is the veterinarian formula. So if you have a veterinarian, that's who you'd want to go for, right? And I did say that the cost is probably twice as much if you're buying this probably from a pet store, if you find one there, or if you find it online.
Now, to that point, and Nancy's calling us out here, don't they usually jack up the prices? Now, Nancy, jack up. I don't want to say that.
Wait, does she mean the pet stores or something else?
So the veterinarians, when we buy and store and pack and deliver and prescribe out medications, there is a markup for it. So yes. So you're not going to get the same price from the distributor. Like, just like if I go to the food store, they're going to jack up the price a little bit there too. but there might be, it might be cheaper for you to find it from your veterinarian over Amazon, which then doesn't have the taurine in it. So I think that's the bigger pickle in this whole situation, because it's actually not that expensive, right? Nancy says markups nice. Thank you, Nancy. I have to stick up for my vets, out there. But
I like reading people's thoughts on the side of this when we're doing it.
I'm casual. They could say, okay, so what if your vet doesn't carry this? So Pat asks, Becky, let's say Pat's got a clinic that doesn't carry it.
So ask your vet to carry it. I'll go back to when this launched. I believe Clipper, the company that I work for, Clipper Distributing, launched this product at AAFP.
which is the American Association for Feline Practitioners. See, Becky forgets that she's not talking to veterinarians.
I forget who I'm talking to.
Just OTC was over the counter. VMX was Veterinary Medical Expo. Who invited you on this show?
I don't know. I talk in jargon, apparently. I need to get out of my house.
Don't we all, right, everybody? So the American Association for Feline Practitioners, which is like a big thing in the vet world. Tell me, Becky, what were you going to say?
Yeah. So, this product was launched and it took off like crazy, right? Because cat people heard about it, found about it, and it just went wild. And then, long story short, the world as we knew it really shut down, right? And so a lot of vet hospitals went to curbside or had to close down. And so there just wasn't a lot of information dissemination, right? And so you had a product that was really peaking and doing really well. And then people had to figure out a whole different lifestyle of how they were living and doing things. So people would turn to online stores, or they turn to just typing in if they knew something for their cat and then picking out whatever they chose, right? And so there weren't a lot of veterinarians at that time that knew about it. So even when we went to this conference in June, VMX that I referenced, there were a lot of people that still didn't know about it. A lot of veterinarians that weren't aware of Churu. And so that's why it's been a little bit slow on the uptake, but now it's just like wildfire now that everybody finds about it and grabbing it and knowing where to get it. And so if your vet doesn't have it, it's probably highly likely that they don't know what it is. So
100%. So it's not like they don't want to have it, but so they just need to know to get it. And if some of them also have online pharmacies, a lot of them, so for instance, we have an online pharmacy at Lap of Love, and that is, we call it's Covetrus, which is the company that provides that, and they sell it. So let's say, Pat, your kitty cat was one of my patients. I can then create a prescription on our online pharmacy for you to get it through there. So even if they may not carry it in-house, because it does take up a lot of time, space, everything to carry all these products available, but if they have an online pharmacy that provides it, they may not even know that they have it. So Nancy says, I would never be without it again. So you've got a fan. And Nancy, now
I'm telling you, that conference in June down in Orlando, people sought us out. They sought out Clipper.
I'm sorry, that means I told you.
Because Dr. Mary Gardner talked a lot about Churu. and sent a lot of people our way because she's such a good advocate.
But to be fair, right, a lot of people don't know. Listen, not everybody knows Lap of Love and me, which is crazy that it.
How do you not know Dr. Mary Gardner?
How can we not? Okay, so I've got 2 questions, and then we got to start wrapping this up. I told you we could start chatting for.
I know.
I got 2 questions. Claudia says, is Churu good for those with a sensitive diet? My kitties are on sensitive diet, and you are right. They seem to get tired of their prescription food. I'm hoping to help them to like their food. They eat their food. They just don't finish it. And you mentioned you could use it as a topper. So any feedback from other vets about sensitive kitties?
Not really. We really don't have a lot of questions about that, right? Because it is all natural ingredients in it. It's basically.
I would caution, sensitive is different than allergies. So, if a kitty cat has an allergy to chicken or some ingredient, watch out for that. I can't stand allergies; they're such a pain.
Right.
But a sensitive stomach, I would definitely check it out and see. Just try what's great. You can just put a little bit on there just to see if they're eating it. And then Emma says, "Can you give Churu to cats that are Why, thank you, Emma. You apparently primed me for what I just said. And she asked, can I give them to allergic chicken? So no, don't give it to the allergic one. It's like, man, I think Becky and I do need to get out of our houses because we can't handle a little 30-minute conversation.
Well, that's why people ask, right? That's why they ask. I mean, if they're allergic to both, obviously no. If they're allergic to just one, right? If they're, say, allergic to chicken.
And then you've got a stocking stuffer for somebody else.
Yes.
To be allergic. Okay, so Tammy says she's going to try to find out how to get some for her kitty today, for her kidney kitty. Oh my gosh, these are amazing. All right, Becky, what have I forgot to ask you, or you forgot to ask?
A few things, just because we're seeing people wanting to know how to get it. Again, if you don't think that your veterinarian has it, one, knowing where to find it, right? So going to churuvet.com.
Churuvet.com.
Churuvet.com will give you everything you want to know about Churu Vet. Okay. And that way you are comfortable pronouncing it, saying Churu, when you talk to your veterinarian, if they'd like to bring it in, or if you're just asking.
Churro, like, listen, I just dated myself. So please, anybody who knew who Churro was.
I heard at the conference in June, many different interpretations of how to pronounce Churu. So making sure that you're saying it correctly. But again, I mean, if you have a veterinarian, every veterinarian has a veterinary distributor account. And so they have access to bring this into their hospital. But just arming yourself with information that you'd like before you walk into your vet. You can find everything at churuvet.com. We are on Instagram. We have a private Facebook page. We're everywhere. We're everywhere. You can find us through Clipper Distributing. So if there's anything you want to know, type in churuveterinarianformula.com and you're going to find all the information that you need to know about that.
So this is not prescription, right?
Yeah.
So
right.
One last thing for everybody to know, your veterinarian cannot prescribe medications. Rick's got us, man. He posted
Rick, thank you.
Rick. So your veterinarian cannot prescribe or give you prescription medication without seeing your pet within 6 or 12 months, depends on the area and state and laws or whatever.
Right.
Since this is not a prescription, you can still buy it through there. So if they don't carry it, what's nice is they don't have to buy a case of 12 of these, right? So they could buy, right, Becky? They could just buy one or two of these. I just might have said something wrong. So if you go in there and say, "Can you please get me this?" They could buy. You don't have to have an exam or anything like that. It's like buying. I mean, I don't want to call it like catnip, but it's like buying catnip from your clinic. It doesn't require you to be seen. So it's not a prescription.
Do people buy catnip from clinics, Mary?
Okay, my clinic, I am such a sucker for everything my clinic has. I bring my own cat to a clinic. I don't, and they got these great little catnip. It looks like cigars and a banana, and she gets one every time.
I think people think it's so funny. Stuff comes out for cats, and people are all over it, right? Because again, that we've just catered to companions for so long.
They're underserved. Love. Nancy has one more thing. I just wanted to say to you that I was so sad that I missed the boat by a couple of days from a beautiful Felix. I had an appointment with you guys the first time. Do it. Sorry, Nancy. Do it on a good day, not a bad day. And I missed the boat by 2 days. I know, Nancy. You know what? I have also missed the boat, just so you could feel better about it. And I've lost my own dog. He died, and I wasn't home, and that has always helped me for the next one. So that way I don't lose the next one that way. And so I'm sorry, Nancy. All right. So Becky, we are out of time.
Oh man, 30 minutes just flew by.
I told you it's gonna fly by. So thank you. Thank you
for everyone that joined.
Yeah. And I hope this helps you guys. So love up on your gray muzzles for me and your crunchy little kitty cats.
Bye, everyone.
Bye.